tailbone pain or pain in the coccyx, pain in the end of the spine. What exactly is the tailbone? This is what is the most painful part for few people. Hi friends, good morning. My name is Dr. Himanshu Gupta, Director at Nivaran Pain Relief Center Private Limited. So I'm an orthopedic surgeon by profession and by training, and as a hobby as well. So I would like to talk about different topics which happen in our OPDs on a regular basis, what we are seeing the patients most commonly presenting with. So today I'll talk about tailbone pain or pain in the coccyx, pain in the end of the spine, which many of the people usually present to us in the OPDs with. So what actually or what exactly is the tailbone? So this is the lower part of the spine, and if you see, this is how the curve of the sacrum ends, and that's the coccyx or the last part of the bone, which is called as a tailbone. This is what is the most painful part for few people. Most common reason that we see causing coccydynia or tailbone pain is a fall on a hard surface, or a fall on the floor, fall on the stairs, fall on the ground, while playing, while coming down, you slipped down and you directly landed on your buttocks. That's where your tailbone can get injured. So that's the most common cause for this pain to start off. Second common cause, which is non-injury related or acute injury related, is a repetitive stress injury, which usually happens in people these days with prolonged sitting postures, when they're sitting for long hours on hard surfaces, hard chairs, or even working from home and sitting on beds. That's another reason which leads to tailbone pain, but again, it is a postural issue. Now, how do you treat both? In the first case, where it's an injury related thing, you try and give rest to that part, do some icing, avoid too much of weight on it, and take some anti-inflammatories, and usually settles down in a week or 10 days, maximum 15 days. A pain which is postural, first and foremost, even if you're doing hot fermentation, seeds bath, or you're sitting on a cushion, you still need about 3 to 4 weeks of constant posture correction, wherein you're walking and moving in between your sitting postures. Every half an hour you're moving around. In some resistant cases, you need to do the second level, which is adding on some physiotherapy, adding on some manipulation to bring the tailbone into proper perspective in this regard to the sacrum, and even lose weight in a few cases. Worst case scenario, none of that has helped you, or you've been doing all this by your own or visiting a doctor, but still it is not helping. Then what? Usually we need to, in such cases, do a small block which is called the ganglion impar block, which tends to have a perfect result in terms of decreasing the sensitivity of the tailbone and aligning it with the sacrum. So just as we discussed, if we cannot definitely avoid falls, we can actually prevent them by being more aware, but we can definitely avoid the postural cause of these tailbone pains. Last but not the least, if you have shown your doctor, everything has been taken care of, then it should heal up. If it has not been seen by a doctor, you should definitely visit an orthopedic surgeon or a surgeon to see if there is some other cause to this tailbone pain, which could be related to a general surgical issue like a fistula or a fissure, or sometimes it is just a sinus, a parietal sinus, which is causing these symptoms. So all of these need to be ruled out, and we should try and avoid too much of self-treatment and self-medication to avoid a acute condition becoming chronic over the period of time. Thank you all. Happy sitting.